Hello everyone, I'm Dr. Samhita here. I'm a psychiatrist from Hyderabad and I will be talking about depression today. Firstly, I would like to differentiate what is the difference between sadness and depression. A feeling of sadness, loneliness, or a feeling of grief when you go through a difficult life experience is absolutely normal. And here in such a situation, you would be able to tell that you can bounce back in some time, if not now. But what if you're unable to bounce back? Then this could be a symptom of major depressive disorder. Now coming into the clinical symptoms of major depressive disorder. Now firstly, there could be symptoms like sadness, emptiness or crying spells. There could be decreased interest in your day-to-day activities, a significant weight loss or weight gain, which is around 5% of your total weight in a period of 1 month. There could be symptoms of fatigue. There could be excessive sleepiness or there could be insomnia. Then there could be symptoms of hopelessness, worthlessness, or even excessive guilt could be there. There could be problem in your attention and concentration. Now, what do you do when you get to know you're depressed or maybe you have the symptoms of depression? So firstly, meet your psychiatrist to know the severity and also the different types of treatment options which could be suitable for you. Next, reach out and stay connected. Get moving. Try to do different things that make you happy. Eat a healthy, depression-fighting diet. Spend some time under the sunlight and challenge the negative thinking. Now coming into can depression affect anyone or what could be the reasons for depression? Now firstly, it could be brain chemistry where there are abnormalities in their brain chemical levels which can cause depression. Second, it could be genetics or hereditary, or it could be few medical conditions like diabetes, then cancers or Parkinson's. It could be some major stressful life events, or it could be certain medications, few medications like your sedatives that you take, or few medicines like steroids, or the medicines that are used in seizure disorders may also cause depression. The recreational drugs or alcohol can also cause depression. Now coming into the personalities, there are few people who get easily overwhelmed or few people who have problem in coping up with situations. Such people are more prone to depression. Now coming into the gender part, women are 2 times more prone to depression when compared to men. And this could be attributed to their hormonal levels, maybe because of menarche, or it could be pregnancy, miscarriages, or it could be postpartum, or even during menopausal time. The next question would be, does every person with depression need treatment? Now, different types of depression are treated by different types of treatments. Now, coming into mild depression. So in such a situation, first is trying to let them understand what is depression, and the next is lifestyle modification, and thirdly, by taking any kind of psychological therapy which is done by a mental health professional. Now for people who are undergoing depression between moderate to severe, in such a situation, first is medication, second is different types of psychological therapies as required by their problem, and next is different types of alternative medication which could be hypnosis or biofeedback, and lastly brain stimulation therapies like it could be ECT or it could be vagus nerve stimulation or the transcranial magnetic stimulation.